Welcome to Get Moving TV. I'm Dr. Chris Landon and I serve as your host. As the Director of Pediatrics here at Ventura County Medical Center, it's come up that I've been here for some 2 decades. As the Director of Pediatrics, I've searched throughout the county for friends, for people who can help our children, help our families. Casa Pacifica has blossomed while we've been here over the last 2 decades. A number of programs have come about, and we've gotten tremendous support from the Board of Supervisors and the Ventura County Healthcare Agency as it's grown. As you end towards 2 decades of being in one place, people start to notice that perhaps some good things have happened. David Friedland, who's here today, gave me a call, and the Kids and Families Together said, you know, Chris, you've been around for a while. You've taken care of a lot of our children, and we're going to hear from one of the moms a little bit later. And so, as part of his reward, he gets to come on Get Moving TV and tell us about his program. So, as we've reached out, tell us about your program, who you are, and.
Well, thank you for having us here, Dr. Landon. And you really were deserving of this award. Twice a year, we give these awards out for people who have gone above and beyond to do things for our children. Primarily the children that we work with are children who are in the foster care system. Kinship, we have a lot of relatives, especially grandparents, raising children now in our county. The last census said about 20,000 of them. 700 kids in the foster care system, and who knows how many kids we have adopted throughout the community. So we kind of specialize in all those groups. Both we work with the children and we work with the caregivers. We specialize in creating attachments and bonding. So,
well, when you say you work on attachments and bonding, it's hard enough being a parent, and as I try and raise these children to take care of children when I have a 16-year-old mother, we're going to talk later about just how difficult it is to be a mother and how many mothers end up so depressed they have a hard time taking care of their children. These children in foster care, they've been in unusual situations. That's how they've gotten there. And is there any kind of program, some kind of therapeutic play kind of program that you help the parents, the foster parents, learn some new skills?
We have a couple different modalities that we use for these kids. And you know, what we've found out and what we know is that many of these kids didn't have the opportunity to attach and bond with their caregivers when they were very young. They missed out on that opportunity. So one of the programs we have is called TheraPlay. It involves both the caregivers and the children. We work with them and try to do some of the stuff that they missed out on when they were very young. So it's very exciting. It's very new and different. We're about the only ones that do it here in Central California.
Okay, can you go through kind of a TheraPlay session? So I'm a child, I haven't grown up with, well, to get attention in the house, I might knock something over, so at least someone will hit me, and then of course they get taken away and put into foster care. So when they have that kind of attention seeking, how do you work your way through it? I know the TheraPlay is a very specialized area, and one that you teach and help people to work through and really provide families and children a chance to work through this attachment disorder. Certainly when I look out in my waiting room at my clinic, I see 70-year-old parents of 2-year-olds, and they just don't really want to necessarily be parents twice. It's one thing to have a grandchild and be able to slow the car down to 35 and give it back to mom and dad, I suppose. But with kinship, how do you help to support kinship care?
Well, being a fairly new grandfather myself, I can't imagine raising a child or a baby now. I can't imagine. I would if I had to. So bless these people who really take on the responsibility. For whatever reason, the biological parents aren't able to care for the child, so we have these relatives that step in, primarily their grandparents. Often they live on a fixed income, and we've even had great grandparents who are actually raising these kids. And we have about 4,000 children who live with grandparents as the primary caregivers in our county, which is a huge number. So the state and the county has really just started recognizing it's doubled since the 2000 census. I mean, so it's really getting much bigger. And so they've recognized this, so they've provided some funding for this, and there's more funding coming, we hope. It's limited. And the funding allows us to work with not only the grandparents who are raising kids that are within the child welfare system, they've been taken away formally from their caregivers, but informally, because most of the grandparents we have raising children are doing it informally in the county. So they have very few services that are for them. So we provide food share, we're a food share provider. We provide counseling, specialized counseling, again, the Theraplay. We do case management where we work with them. Often they don't have beds, they don't have clothing. We work with organizations in our own organization that help them with those things. So we're really in there with them in the trenches trying to give them whatever they need to be successful in raising these children.
Now, are there other, in the San Fernando Valley, are there services like this? Is this really spread throughout? Or I know you seem to have a nucleus in Ventura. Are you looking to expand? Are there a need there?
Well, we serve Ventura County. We would like to start opening. Our office is in Ventura. We're fortunate that we're in an old Victorian house that's a city landmark. We'd like to have a center, though, on the east end of the county. So hopefully we're going to be moving in that direction, and we're very excited about that. Because we know a lot of caregivers are on the other side of the hill, the grade, and we want to make ourselves more accessible to them. They come to us, but we'd like to make ourselves more accessible to them.
And then do you help the grandparents work through some of the legal issues when someone comes in and I have to give a child an immunization? Would that be one of the resources?
Well, we have resource specialists that are part of our staff. So we would point them in the direction where they can get help, and we'll follow up as much as we can to see that they get the help they need. The Self-Help Legal Access Center provides guardianship help, and so we often work very closely with them. We'll go in and sit down and do the paperwork with them if we need to. We have bilingual staff, bicultural staff that helps our people in the Latino population.
We're coming up on the holiday season. As a nonprofit myself, I have to get toys from Toys R Us and get kids to camp. What kinds of things do you need in terms of supporting all this care for children and supportive kinship care?
Well, you're right. The holiday season is a big time of need for these families. And again, the foster parents have places where they can get some stuff donated to them. A lot of these kinship families that we're dealing with, the grandparents and the aunts and uncles are on very fixed incomes and are not able to provide for these children or give them, really a nice holiday. So we do take donations. We try to provide them with food. We work with Food Share and try to provide them with food. And so we try to match the kids up. We have their ages and their sexes, and we try to match them up with people who would like to buy things for them for the holidays.
And then how about your larger needs? So do you need a van? You need a building in Thousand Oaks?
Well, we do need space in Thousand Oaks, so we're starting to look for that. We need, our building has a lot of deferred maintenance that we need a little help with doing. It's an old Victorian historic house. Again, that's not where we are first to put our money. We want to put it into our services. So help and donations there would be helpful.
Well, thank you so much about sharing about this very important program. So Ventura, we need to get moving on this. We need volunteers, we need refreshments, we need childcare. So it's time for you to help out with kids and families together. So get moving, Ventura.